Hey listeners, this is Kelsey and Nate here from the Emergency Medical Minute, and we are excited to tell you about our next big event, Untamed, an event about medicine and wilderness as medicine.
Picture this. You are canyoneering in the San Rafael Desert, the most remote desert in the United States, and suffer an unfortunate fall that leaves your right hand pinned by a boulder. Posed by the threat of death by dehydration, you have to choose between your life or your limb. Our keynote speaker, Aaron Ralston, portrayed by the film 127 Hours, was in this exact position. Guests will hear Aaron's story, along with other inspiring tales of survival.
Guests will also hear from a panel of medical experts on how to survive the wilderness and embrace it as a form of medicine. Tickets and event information are available on our Facebook page and website, emergencymedicalminute.com.
Talking about the other day, we see patients with cellulitis. One thing that kind of can be difficult is who's going to really fail the treatments, and I think a lot of it's just a guessing game, and maybe we have some risk factors we think about. And so I looked into it a little bit, and there's not any good evidence. There's one study that's published this year in June that did try to help kind of data mine for some of the risk factors for treatment failure. So that would be a change to a different oral antibiotic, IV administration of antibiotics, or hospitalization. And most of them are kind of intuitive, like cellulitis in the last 12 months, chronic ulcers, and a history of MRSA. The one odd one that carried the highest odds ratio was tachypnea at triage, which I was trying to think about physiologically how that would make sense, but it was just kind of an interesting one. But at least there's something to kind of provide some evidence to things I think we all intuitively think about. But not a lot out there, so it's still kind of a guessing game, I think. But that's it.